And so this evening, I want to introduce Dr. Gerald Bell. He is an adjunct professor of genetics at Cummings School of Veterinary Medicine at Tufts University. He also practices at Freshwater Veterinary Hospital in Enfield, Connecticut. He earned his DVM from Cornell University and was trained in genetics and genetic counseling at Michigan State University and University of Missouri. Dr. Bell also practices and owns the Freshwater Veterinary Hospital in Enfield, Connecticut. He is chairman on the World Small Animal Veterinary Association, Hereditary Diseases Committee, and the board of directors for the Orthopedic Foundation for Animals and the American Kennel Club Canine Health and Welfare Advisory Panel. So thank you so much for Dr. Bell for being willing to share some of your insight to genetics with us this evening. We will, I think, take questions as you had previously agreed to kind of throughout the presentation, and those should be down on the side. If when I see anything pop up, I'll bring it to your attention.
Okay, sounds good. Depending on how the timing goes, because I've got a lot of things that I've included in the PowerPoints to cover as a practitioner. And that I think would be helpful for all of you as practitioners to know and understand. So if we don't get too bogged down, we'll get through it all. Otherwise, I've tried to leave time at the end for questions as well. So let's see how it goes. But certainly if you have questions while I'm going through things, let me know and we'll see how that works. So the other thing is when I minimize the go-to, it pops out of screen mode, so sometimes you'll see that happen. So I apologize for that in advance. So tonight we're talking about using genetics, genetic testing, and genetic counseling to improve patient health. And so as just for information purposes, I am on the board of directors of the OFA, the Canine Health Information Center. It is a volunteer position, as all of the directors are. We don't get paid. And the OFA is the largest genetic screening database in the world of test results on dogs. And I'm going to show you some of the tools that are available on the OFA website and how you can utilize them in your practice and help your breeders with them as well. I am the owner and solo practitioner at Freshwater Veterinary Hospital in Enfield, Connecticut. I do not see a lot of breeders in my practice because actually there's a reproductive vet right across the river from me about 2 miles away, and so she has all the breeder clients. And so really what I see are pet dogs and cats primarily. And so I'm seeing what is being bred just like you are, and what is being purchased and what is being rescued and adopted in my practice. And so this is what I've been doing for almost 40 years now, and that has informed the way that I practice. So I do see dogs in my practice as well as seeing cats, and pretty much just pet dogs and cats all day long. I just finished seeing appointments at 6 o'clock my time tonight and rushed home and ate dinner and let the dogs in and out and took care of things so that I can share this with you this evening. So we're going to do some polling tonight, and I'm going to have you either use your phones, or if you want to open another web page on your screens. The easiest way to do the poll is to go to the web page pollev.com/mcvma, and then all of these poll questions will just pop up on your screen and you can just tap to answer them. If you'd like to use text instead of polling, you're texting to the address 22333, and for the first time only, you're going to type in MCVMA and hit send. And then whenever any of the polls come up, you can just tap in your answer, A, B, C, D, or E, or whatever the answers are here, and hit send in that way. And so this is just a practice poll, but there's a reason for me asking these questions, and I'll tell you that in a second. So the question is, I am a private practice veterinarian, corporate practice veterinarian, academic clinical veterinarian, non-practicing veterinarian if you're not a clinician, or non-veterinarian. So again, the easiest way is to go to the webpage pollev.com/mcvma, and these polls will just pop up automatically, or you're texting to 22333. One time only, you'll enter MCVMA and send that, and then after that, you're just sending the letter of your response to the question. So we've got 7 people so far, and my understanding is we have about 15 people or so with us tonight, so we'll just give you a couple more seconds. So the reason why I'm asking this is primarily the difference between private practice veterinarian and corporate practice veterinarian, because a lot of the corporate practices are owned by Mars, whether it's Banfield, whether it's VCA, whether it's some of the others that that Mars has scooped up in their conglomerate. And Mars is really pushing now the wisdom panel testing. So they're telling all their corporate veterinarians at Banfields and VCAs to run wisdom panels on every single one of your patients to inform you about the genetics. And in practice and in theory, it's a good idea, but I'm not sure that it's that informative yet. And we'll talk about that, and we'll talk about those tests tonight as well. So let's see the, hold on, let's see the responses. So 50% are private practice veterinarian, 42% are corporate, and 8% are non-veterinarians. So that's the reason I mentioned that, because that is something that is being pushed in the corporate practices to run wisdom panel tests. So we're going to be talking about what those types of tests will tell us. Okay, so what is the practitioner's role with genetic disease? In the last century, we have learned to control infectious, nutritional, and environmental causes of common disorders, making genetic predisposition a more frequent disease etiology. Predictability is the hallmark of genetic disease. So with genetic disease, very often, if we have genetic tests, we can actually predict disease before its onset. And so our role as veterinarians with genetic disease is early diagnosis, intervention, and prevention. I wanted to do one thing here. Okay, great. So genetic diseases should be recognized in practice because they must be treated as chronic illnesses and not episodic diseases. So almost all of the chronic illnesses that we deal with in practice are hereditary diseases, are genetic predispositions, and that's why they continually come back again and again with the same type of problem, whether we're talking about allergies, whether we're talking about inflammatory bowel disease, whether we're talking about feline neurologic syndrome and inflammatory cystitis. You know, if we treat them as, you know, or even chronic ear infection, which is allergies, you know, if we just keep on treating them each time it comes up, our clients get very tired of paying for the cytology and paying for the drops and the flushes and everything, because we're not really preventing the onset of those diseases. We're only trying to put the fires out when the fires keep on coming up from the embers. So we really need to look at genetic disease as chronic disease. So next poll question: are mixed breed dogs and cats inherently healthier than purebred dogs and cats? I want to apologize for you tonight. I know what, you know, I understand from the news what you guys are going through with the freeze and you know, I live up in the Northeast. I've had times when we've been out of power for 10 days in a row at one time, and even this past year there was we had 4 days where we had no power. And I understand you have very little drinking water, so I apologize if I keep on drinking bottled water here, which you may not have available to you that easily. So sorry about that. Okay, so let's see what their responses are. So are mixed breed dogs and cats inherently healthier than purebred dogs and cats? So 55% of you say yes, and 45% say no. And so we'll talk about that today, but there are actually articles, there's some excellent JAMA articles that compare populations of mixed breed versus purebred dogs, at least, and show that on average, we see genetic disease equally between mixed breeds and purebreds, because the bottom line is the most common genetic diseases we see across all mixed breed and purebred dogs and cats, and it's only the rarer diseases that tend to circulate in the purebred dogs and cats, but at much lower frequencies. Okay, and my last question before we go on. Purebred and pedigreed cat and dog breeds are all inbred. True or false? So dog and cat breeds are all inbred, an absolute. True or false? You're not jumping on this one as quickly. Okay, so we got, so 42% are saying true and 58% are saying false. Well, actually the answer to this one is true. You know, breeds are inbred. And that's part of the issue that we have dealing with this is that people think that inbred breeds is always going to be bad because inbreeding is bad. And so we need to understand about breeds, and that's what we're going to talk about first here, to understand the genetic background of breeds. And so we do understand what the results of genetic tests are, especially genetic diversity tests and so forth that are being marketed by the commercial companies. So we'll be addressing those tonight. Okay, so there are actually four now, but you know, there are three essentially different groups of dogs and cats. There are purebred dogs and pedigreed cats. So purebred cats they call pedigreed cats. They don't tend to call them purebred as much. And those have defined pedigrees and established ancestry within the breed. Then there are designer breeds, and in dogs, those are crosses, usually first generation crosses between two breeds. In cats, designer breeds are actually crosses between domestic cats and wild cats. So you have your Savannahs, you have your Chauceys, and so these are actually crosses between domestic cats and wild cat species. And then you have your random bred. And this is where there's actually a new category, because random bred to me was just alley cats and mutts that are breeding on their own. But we now have a large industry of bred for rescue, where mixed breed dogs and dogs specifically are being bred because people want to rescue dogs, and there are not enough rescues out there. So people are purposefully breeding dogs for rescue, and you know, you have to question at some point why, you know, we see all these rescue puppies coming in. You know, how do puppies become, you know, homeless and need to be rescued all the time? It's because they're being bred for rescue, and so when looking at this, mainly what I'm trying to make a distinction of is that there's a difference between purposefully bred dogs, whether they're purebred, designer bred, or you know, mixed breed but purposefully bred, where a person decides who gets bred to who, versus random bred, where the animals are making the decisions themselves. Whoops. So let's talk a little bit about purebred dogs and pedigreed cats. And so this is a little bit of a conceptual part of it right now. So I just want you to think about this. Cat and dog breeds are like different ethnic populations of people. All people on Earth are humans, or Homo sapiens, but we are not all closely related. Ethnic populations originally arose due to geographic isolation. So we know that man came out of Africa to the Middle East, and then we had migrations into Europe. We had migrations westward to India, to South Asia, and then to Southeast Asia and Oceanica. We had migrations up, you know, through the steppes into northern Asia, and then down into other parts of Asia. And then we had the more recent migrations to North America and to South America. There are some ancient mutated genes and hereditary diseases that are shared by different ethnic populations. In some ethnic populations, certain common genetic diseases occur at a higher frequency, like high blood pressure or diabetes. Some ethnic populations are prone to certain genetic diseases that are seen very rarely in other populations. So dog and cat breed development followed human migration and evolution paths. So man took their dogs and cats with them as they migrated around the world. And so different breeds that were established in different parts of the world were established by those migrating human populations as well. And so common genetic disorders are caused by ancient disease liability genes that preceded breed formation. And these are shared by many, if not all, breeds and mixed breeds. So these are our common genetic disorders, the ones that we see all of the time. And so this figure is from an article by the Broad Institute, where actually part of the picture was the wolf population that came down this side here. And these are offshoots from the wolf population, which were multiple founding events to find the domestic dog, the evolution of the domestic dog from the wolf populations. And so you had different domestic dogs here, and then they started to be bred for different purposes. There were dogs of war, the mastiffs. There were scenting dogs and hunting dogs. There were herding dogs and so forth. And then eventually you get down to your individual breeds down here. So there are some genetic diseases, allergies being one of them, that we see just about across every single breed and mixed breed individual. So the genes for allergies are ancient liability genes, as are for hip dysplasia, and then you get a little further down where you get genes for patelloluxation or aortic stenosis, or for very specific breed-related diseases down here. So the common canine genetic disorders, allergies is number one. We see allergies every day in practice, and that is the number one genetic disease that we treat. Hip and elbow dysplasia, inherited cancers are big four, hemangiosarcoma, lymphoma, mast cell tumors, and osteosarcoma, and then right behind them, squamous cell and melanoma and so forth. These are all inherited. Patelloluxation, non-struvite bladder stones. We know that struvites are caused by infection. All other bladder stones are due to inborn errors of metabolism and are hereditary diseases. Autoimmune thyroiditis, mitral valvular disease, inflammatory bowel disease, diabetes mellitus, retained testicles, umbilical hernias. These are all common genetic disorders. So let me focus on allergies. Just, I'm not going to do a talk on all different diseases, but I wanted to share with you some things that the way I look at allergies as a genetic disease when I'm treating my patients. All of these presentations are presentations of allergies. So chronic inflammatory otitis is probably the number one presentation that we see, recurrent ear infections in these allergic dogs. And understanding the allergic etiology of it helps us to treat these more on a chronic level. Hot spots, foot allergies, inhalant allergies, flea allergy, dermatitis, staph hypersensitivity, food allergy, which we know is a minor part of allergies, but of course all of our clients think that if their dog's allergic, that it's going to be a food allergy, so we need to counsel them on that, and contact allergies being kind of infrequent. So allergies are seen at variable frequencies in different breeds. That picture back there that I showed you of the West Highland White Terrier, it's one of the poster childs for allergies, because we see a lot of allergies in those dogs. Actually, we see a lot of allergies in white-coated breeds as a liability. A study that was done in 2004 on Goldens and Labrador Retrievers showed that allergies were 47% heritable, which is really highly heritable. When we think about some of the things that hip dysplasia, we consider about 27% heritable. And if you think about the production species, large animal species, egg production, milk production, meat production, those are all about in the high 20s for heritability as well. So allergies is a highly heritable disease. And there's a predictable seasonality in chronic cases. So when you see allergies, you need to look back through the history and see, has this dog presented before? What seasons has it presented? What can we do to predict things? We even ask the client, what is the worst season? These are things that we need to really ask our clients about to be better veterinarians, because allergies are chronic diseases, and we need to try to control them in a chronic way and not in an episodic way. There are some studies that even show that the breeds each have different presentations of where their allergic lesions are, where some breeds have more pododermatitis and some have more abdominal reactivity, and some, like the Shar-Pei, can just be allergic all over. Arthritis is highly heritable, as well as the inherited musculoskeletal diseases that we see in dogs. So our next poll question, is there a genetic difference between an old mixed breed dog with hip arthritis and a 2-year-old purebred dog with a radiographic diagnosis of hip dysplasia? Yes or no? Only 4 get answered, but let's see what the responses are. So 80% of you say that yes, there's a difference. Well, in actuality, for most cases, no, there's no difference. You know, we put a label of hip dysplasia on purebred dogs because we're radiographing them for breeders at 2 years of age with an OFA or a pen hip. But in reality, our old dogs that have hip arthritis, that was hip dysplasia, and we can actually document it early on, and I'll show that to you. But there's no breakdown between a mixed breed dog with hip arthritis as not hip dysplasia and the purebred dogs have hip dysplasia. It's all the same disease. So let's talk about canine hip dysplasia as a genetic disease. Well, we know that we can have severe hip dysplasia, and it could look like this, where you have severe, it's not just subluxation, but luxation of the hips. And this dog also has severe hip dysplasia, but we can see that the heads of the femur are deep in the acetabula, even though the acetabula are not very deep themselves. So laxity is not the biggest component of hip dysplasia in this dog. And what that tells us is that this is a syndrome. There are many different genes that can contribute to hip dysplasia, and there are many different presentations of hip dysplasia. Some have more laxity, some have more of a liability to osteoarthritic changes. And so in some breeder, when I talk to breeders, sometimes I'll make a joke that, you know, if you breed these two dogs together, they could produce normal hips, although that's not the message of the talk. But these dogs likely have hip dysplasia due to different genes. And that's the problem with complexly inherited disease, is that not everyone has it due to the exact same cause. And small dogs, this little Shih Tzu here has severe hip dysplasia as well. We don't see it clinically as much because they don't have the weight stress phenomena as the big dogs do. But we certainly do see a lot of small dogs with debilitating hip arthritis from hip dysplasia. So it's not just a big dog disease. Okay, I have a question here. When taking diagnostic radiographs for hip dysplasia, I use general anesthesia, deep sedation to the point of muscle relaxation, light sedation for proper positioning, or physical restraint only. Got to have more than 2 of you answer. So there we go. Okay. Come on. Okay, we're up to 10. So let's see what we've got. So general anesthesia and deep sedation to the point of muscle relaxation are the two most frequent. And then we see light sedation for positioning, 8%, and physical restraint only 17%. So when I first got out of vet school, and my master's work was on hip dysplasia, actually, I was a master's student at Missouri, and it was funded by the OFA, which is at Missouri. And when I graduated, I thought that the whole reason for using sedation or anesthesia was just for positioning purposes. And if I can get a dog to lay there and get a proper positioning with physical restraint, it didn't make any difference. Now I understand much better because there are published studies on this as well. If you don't have at least deep sedation to the point of muscle relaxation, you are hiding laxity. You are allowing the dog's muscles to hold that hip tightly, and it's masking dysplasia. It might make your client happier if they don't have a diagnosis, but it's not going to make them happier when they're producing dysplasia because you have masked it. So it's really important that we use general anesthesia or deep sedation to the point of muscle relaxation. Okay, so canine hip dysplasia diagnosis, we can do it through palpation, an Ortolani sign, or a modified Barden's, and I'll show you those in a second, or imaging, the ventrodorsal radiograph, which is the OFA view, as well as the view most of the world uses, and then the Penn hip view, which is the distraction index, which objectifies laxity. So before I show you these, how many of you palpate hips at all in your practice to look for laxity? How many of you palpate dogs' hips to look for laxity, whether they're on anesthesia or not? I need more than two of you to answer. It's a simple yes and no. It's all anonymous here. These aren't being recorded. Okay, here we go. So 70% say yes, and a third say no. So I'm going to show you what I do because it really does inform things for me. And the most important thing that I do is that when I spay and neuter every single dog, before we wake them up, so at the end of the procedure when everything's completely relaxed, I will palpate the hips and I will do an Ortolani on this sleeping dog on their side. And with the Ortolani, you're going to, put one finger on the greater trochanter of the femur, and with the other one, you're going to grab the stifle. You're going to adduct the femur, and you're going to you can even flex the femur and adduct to try to walk the head of the femur up the wall of the acetabulum. And then when you abduct the femur upwards, if you feel that clunk back down into the acetabulum, that is a positive Ortolani sign. So I do this and I record this on my patients. So that's one procedure that I do. The other one is a Barden's procedure, which is, again, you take your thumb and put it on the greater trochanter. And with the other hand, you're just taking the femur and you're gently lifting the femur. And all of these are gentle procedures. You're not forcing anything because there's complete muscle relaxation, and you're just gently lifting the femur and seeing if you can lift that femoral head out of the acetabulum. Whoops. So what I will do is that I will record in the patient's charts, in every single one of my patient's charts, whether those hips are tight, whether there's mild laxity, moderate laxity with an Ortolani click, severe laxity, and I rarely tell the owners about this and what the results are, but it's in the chart. And if I ever have lameness that's going on later in this dog's life, I can go back to see when I spayed or neutered this dog whether they had laxity there. So I already know whether there could be a predisposition to hip dysplasia. And it's very informative for me to know those things, especially if there's a question, is it a stifle lameness? Is it a hip lameness? I'm not getting a drawer sign. Is it a partial stifle tear? Could it be hip pain? And I already have some data because I palpated the hips when we spayed and neutered them, because laxity is something that occurs early on. The last thing I'll do is that I will even do an Ortolani procedure on puppies when I see them for their vaccine appointments, because the bottom line is there are some salvage procedures to correct against hip dysplasia, but those procedures must be done at an early age before rapid growth and before bony maturation. So if we're talking about a triple pelvic osteotomy or a juvenile pubic symphysodesis, which can improve the hip conformation, they need to be done at a very early age. So again, we're not forcing anything here. It's still a gentle procedure, but you can do an Ortolani on these puppies during their vaccine visits. And if there's significant laxity there, you're going to pick that up and then talk about, well, maybe we needed to do a hip X-ray, or maybe we need to figure out whether this dog needs an interventional surgery if it's going to have a pain-free life later on. with severe laxity, not just mild in that regard. Most, with muscle, without them being anesthetized, you're not going to get mild laxity. You're not going to be able to palpate that as much. But for the worst cases, it clues us in at a time when we need to know about it. Okay, let's talk about cats here. The most common genetic diseases in cats are inflammatory cystitis and feline urological syndrome. So that combination of feline bladder disease is our #1 genetic disease that we see in practice all of the time. And then we have diabetes mellitus, lymphoplasmacytic gingivostomatitis, inflammatory bowel disease, which is also lymphoplasmacytic. Cat inflammation is lymphoplasmacytic. And if someone can figure out how to mitigate and change lymphoplasmacytic inflammation in cats, we would be able to deal with a lot of different diseases that we currently deal with. Again, non-struvite bladder stones, oxalates being the most common in both dogs and cats, allergies, which don't occur as frequently in cats as we see in dogs, and eosinophilic skin disease. So next question, do you perform a quick ultrasound of the bladder on feline cystitis cases? Yes or no? You don't have to think about it. It's a yes or no question here. Do you routinely do a quick ultrasound on cystitis cases? Okay. So 86, 75% say yes, 25 no. So, what I hear now, a saying that I hear is that ultrasound is the new stethoscope. Is that we should be, if we're trying to figure out what's going on inside and we're listening, we should also be looking with an ultrasound. And so the thing with these cystitis cases, we palpate a small thickened bladder. That's what we always do when we see these cystitis cases. Very rarely is there even urine in there for us to do a urine analysis. And because that they have inflammation in the bladder, whether it's from infection or from inflammatory cystitis, and so all they want to do is strain, and they have this thickened bladder. And so ultrasound can tell us, is there wall thickening? Is there gravel? Are we getting a stone reverberation? If it's an older cat, is there tumor? Is there transitional cell carcinoma going on in there? So it really helps differentiate what we're treating and enables us to treat our patients better. So the feline urological syndrome, it's the #1 hereditary predisposition seen in practice. We have a metabolic disorder allowing urinary crystal formation, but we also have inflammatory cystitis. And Tony Buffington came up with the term the Pandora syndrome, where stress is actually the precipitator of that inflammation of the bladder, and that there are actually inflammation of other organs as well with that syndrome. So for cats presenting with crystals or obstruction, we need to treat with low magnesium diets. We need to encourage water consumption. If they have inflammatory cystitis, which is more and more what we're seeing, because most of the diets now have been altered to try to avoid crystal formation, then we need to treat with things that decrease the inflammation of the bladder, glucosamine chondroitins, possibly non-steroidal anti-inflammatories, reduction of stress to the environment. And for some of these really anxious cats with inflammatory cystitis, we may even need SSRIs, fluoxetine and amitriptyline and so forth, just to settle them down so they don't get their bladders inflamed so often. So those are just some of the two most frequent genetic diseases we see in dogs and cats, and how our thinking about those diseases enables us to be better veterinarians by actually looking at the long-term consequences of disease and how we're going to treat them. Let's talk a little bit about breed formation. So this actually is one of my dogs, Smith, who passed away a while ago, but he was our first master hunter, and we're very proud of him. The development of breeds occurred through artificial selection for body type, color, coat type, behavior, and conformational aspects. As breed phenotype, what you see, became more uniform and stud books closed, those who did not conform to the standard or exhibited health issues were removed from breeding. So this is how breeds develop. And this is a picture, actually a computer picture of a single dog's pedigree. So, and when you're looking at pedigrees, this is what we're used to seeing. Here's the dog, here's its parents, here's its grandparents, and here's the close relatives to that dog. But when you have a pedigree database that goes all the way back to founders, these are the founders of the breed back here that started the breed. And so what you have initially is that you have matings being done, and if things are being produced that are not according to what people are wanting for the standard, they are discarded. If they're unhealthy, they're discarded. So there's a breeding and purging process that goes on for many generations. And then once that standard has become fixed and dogs are breeding, and cats and other domestic species are reproducing uniformly and in a healthy process, then you can have an expansion of the population that goes on. And in actuality, this population expands all the way up to here and all the way down to there, but because we're only looking at one individual and only the individual ancestors that appear behind that individual, we truncate on that single pedigree there. But this is what a breed looks like. And it's a three-dimensional picture. It's actually a cone. It's not just a 2D picture here with all of these thousands of individuals in the background. Those individuals who demonstrate and propagate desirable characteristics will have an increasing influence on the gene pool through multiple generations of descendants. So if you produce well, your genes are going to continue to be passed on. Individuals that produce offspring that are unhealthy or inferior are not used, and their influence and that of their ancestors is diminished. So influential ancestors. All breeds have several influential ancestors that appear far, far back in the pedigrees, but pass on a high percentage of their genes to every single individual in the breed. So for instance, the Burmese cat breed, all current modern Burmese cats share on average 22.9% of their genes with the founder of the breed, Wang Mao. And 77.9% of his genes and chromosomal segments have been retained in the population. He doesn't appear on average until the 19th generation. So this is someone that a cat that passes on almost as much as a grandparent in the second generation, but on average doesn't appear until the 19th generation and appears over 1.5 billion times in every Burmese pedigree. So this is an understanding of how the founders of breeds, and not just the founders, but the ones that really epitomize the breed that may have come along later on, that people continued to use their descendants for, how they become influential ancestors. And this isn't just the Burmese. Every single breed has this. So for instance, Cavalier King Charles Spaniels. Every modern Cavalier King Charles Spaniel has almost a third of their genes are from Daywell Roger, who was born in 1945, 30% Cannon Hull Ritchie, and Son 26%. And of course, these add up to more than 100% because some of these are the sires or dams of these up here. And so it's all of the background of the breed that collects and assembles because of the superiority of what these ancestors passed on and what their descendants continue to pass on that is being selected for. So modern breed population statistics show high homozygosity or average inbreeding coefficients, and this is why I'm telling you that all breeds are inbred. Okay, they have a low effective population size or a limited number of founders or number of ancestors contributing to their diversity, and they have a high average relationship coefficients to influential ancestors. So to understand a little bit more about this and to understand about the genetic tests and the genetic test results that we're being given now by the commercial companies, we need to understand a little bit about chromosomal inheritance. So dogs have 39 pairs of chromosomes, one in each pair from its sire and one from its dam. So here are the autosomes 1 through 38, and then you've got your sex chromosomes, the X and the Y. And so at this location on chromosome 3. So here's the chromosome from the sire, and here's the chromosome that they received from the dam. And on this location, there's a gene, and a gene is a functional definition. It codes for a specific process. And whether it's a protein or an enzyme, or whether it's turning on or off another gene in another location. And so the matching gene on the opposite chromosome is called its allele. The location on the chromosome is called the locus. And how those two alleles interact with each other tells us what the phenotype is going to be, or what you see in the dog or the cat. Cats have 19 pairs of chromosomes, 18 autosomes, and then again the sex chromosomes. So to understand why about diversity on this earth, we need to remember all the way back to both high school and college about meiosis, the formation of egg and sperm. And something that occurs during meiosis in metaphase is that we have crossing over between the chromosome that we got from the sire or from our mother, from our father, and a chromosome that we got from our mother. And I apologize for using all dog stuff here, so I put a little cat mask on this dog here for the cat people there, just to make you happy. So we need to understand that the chromosomes that are coming from the sire and the dam, we're just going to look at one chromosome as an example. So in the formation of egg or sperm, those are going to cross over and exchange genetic material. And this is what mixes up the genes on the chromosomes so that entire chromosomes are not inherited intact from one generation to the next. So that haplotype block, that block of chromosome that was inherited in one piece, all of the genes in that block are inherited together. So they are all linked together because they are being passed on together on that chromosome. But we need to understand that this huge block from one of the parents is actually comprised of many different small haplotype blocks that came from ancestors that are showing us the background of the breed. Little pieces of chromosomes there, all due to crossovers during meiosis. Selection for positive traits will cause the inheritance of a chromosomal segment from the parents containing those causative genes, and those get passed on. Selection against deleterious traits or diseases will cause the loss of chromosomal segment containing causative genes. As crossovers occur through the generations, the size of the chromosomal segment containing genes under positive and negative selection can get smaller. So here we have this haplotype block here, but we need to understand that somewhere in this block that is being selected for, when a trait is being selected for, that block is being selected for because that causes the genes that code for that trait. As individuals are line bred on and appearing in both the sire and dam side of the pedigree, or that become influential ancestors that come down both sides of the pedigree, this can cause haplotype blocks to pair up, causing runs of homozygosity, ROH. That's something that the molecular geneticists refer to are runs of homozygosity. So those are haplotype blocks that are lined up due to inheritance from common ancestor. Breed-defining genes would be expected to be collected in runs of homozygosity due to selection over time. You know, it's what's being selected for, so you'd expect the breed to become uniform in those haplotype blocks. These include breed-selected traits for size, coat color, texture, behavior, skeletal morphology, and other traits. So molecular genetic studies of breeds document the homozygosity and haplotype blocks that mirror the pedigree-based inbreeding coefficients and influential ancestor coefficients. So this is a single chromosome. Let's say it's chromosome 7, okay? And these are chromosome 7 from different individuals within the same breed. And when we line them up, what we see here is we see a haplotype block that is uniform across the entire breed. And this is what we call a selective sweep. So because of selection for a specific trait, everyone becomes homozygous at that location, and we have this block here. The fuzzy ends to this block are different because the crossovers occur randomly. But the selection for whatever gene in this block here has allowed this area to be homozygous. Even without close line breeding, selection for positive traits will increase their homozygosity, having originated from distant ancestors. So it isn't just line breeding that's going to cause homozygosity in breeds, it's selection. And selection is the most important thing when it comes to breeding. And that's part of the issue and the problem we're dealing with is that people aren't selecting for health. And that's why we have the problems that we have. But this homozygosity is a necessary and expected consequence of breed formation and evolution. This wasn't done by accident, that, oh my God, look at the homozygosity in purebred breeds. It's done purposefully. It's because of selection that we can differentiate and tell the difference between a Great Dane and an Australian Shepherd. It's because we have selected for traits and we have created uniformity and homozygosity in the chromosomes to produce those traits and to produce hopefully healthy animals. So let's talk a little bit about diseases and disorders, or what I call the dark side of breed development. So this is one of my favorite cartoons, Get Fuzzy. Rob says, ever heard the expression familiarity breeds contempt? And Satchel ponders for a minute, and then he says, no, in the dog world, we say familiarity breeds hip dysplasia. So this is what the general public believes about purebred dogs, is that because they are purebred, you're selecting for disease. And it's what some veterinarians believe as well. So let's talk about this a little bit. How do breed-related deleterious genes accumulate? Well, one way is for direct selection for disease-associated phenotypes. So if you're selecting for a really short muzzle and nose, it's not surprising that you get brachycephalic obstructive airway syndrome. If you're selecting for extreme phenotypes, it's not surprising that you get disease that's associated with those extremes. We'll talk about that in a second. Linkage to selected traits, so that the common example of that is in Dalmatians, where the gene for hyperuricosuriasia, it was tightly linked. It lies close on the chromosome to that spotting locus, and so they actually were selecting for a disease gene when they were selecting for the spots. Carried by popular sires. Use of popular sires is the #1 cause of reduced genetic diversity in breeds, so that is something to be avoided. Genetic drift is the Brownian movement of genes in the background in the absence of selection, so just the up or down accumulation of genes. But most importantly is the absence of selection against deleterious phenotypes. If you have sick animals and you allow those to be bred, you can't be surprised that you have more sick animals. So the absence of selection against deleterious phenotypes is, to me, the biggest reason for the accumulation of deleterious genes. So purposeful selection for disease liability, the brachycephalic obstructive airway syndrome is a big issue now, especially because of the explosion of popularity of the French Bulldog and the Pug and the Bulldogs. But we also have excessive size, excessive skin folds, excessive angulation, extreme skull shapes that predispose to hydrocephalus or syringomyelia. So all of these extremes that people could be selecting for also select for disease liability. Most breed standards do not call for expression of extreme phenotypes. Most breed standards don't say select for the most angulation, select for the shortest possible muzzle. But unfortunately, the more is better. Philosophy has led people to breed to extremes, and that's where we have these issues coming. So we need to talk about moderation away from extremes that cause disease. And so this should be a guiding principle in breeding as well as in judging. If show dogs are being judged, they shouldn't be selecting the most extreme. And many of these breeds that have these issues from extreme phenotypes have counseled judges to not select the most extreme individuals and to select for moderation and reward moderation. Disease is not a function of homozygosity or inbreeding, but of the accumulation and propagation of specific disease liability genes. And that's a really important concept because everyone wants to talk about homozygosity and inbreeding, and that's not what causes disease. Disease is caused by specific genes. It's not just homozygosity, because in selecting for pure breeds, you're selecting for homozygosity, but you don't want to select for disease. Let's talk a little bit about mixed breed dogs and random bred cats. Feral and village populations, which is our random bred and dogs and cats, usually mate randomly and whelp without human intervention. Therefore, there's some natural selection involved if an individual fails to thrive. As veterinarians, someone brings in a fading puppy or kitten, and we try our utmost to try to allow that puppy or kitten to survive. And unfortunately, many of those are then used for breeding later on, and maybe they weren't meant to survive. So at least we have some natural selection in random bred and mixed breed dogs that are out there that don't survive if they have congenital abnormalities. Common genetic diseases in mixed breed individuals occur randomly due to dispersed ancient liability genes. So the allergies, the inflammatory cystitis, all those types of things. Uncommon and breed-specific recessive or complexly inherited diseases far less likely in mixed breed individuals. So we see the common diseases, but we don't necessarily, but it's rare. We do see them, but it's rare that we do see the uncommon diseases or the breed-specific diseases in mixed breed and random bred animals. And lastly, designer bred dogs and cats. Again, we often see them with the common inherited diseases. They also can inherit disease liability genes that are shared by the parent breeds or species. So if you have, two small statured breeds being bred together, short-legged breeds, it's not surprising to see patella luxation. If you see two toy breeds being bred together, it's not surprising that we see mitral valvular disease. But also we can see disease manifested due to anatomical mismatches between the parent breeds or species. So, and we see a lot of this in dental disease, in crowding of teeth, in malocclusions, in mismatches between the upper and the lower jaw, which are inherited separately from each other, but that's a whole different lecture. But also in hip conformation and in joint conformation, you have two breeds that have different morphological features. We can get some pretty bad looking joints. So these are things we need to understand. So veterinarians should be knowledgeable about the specific disorders occurring in breeds, know the screening tests that are available for identifying affected as well as carrier individuals or their disease risk. And this assists us both in genetic counseling for our clients, as well as in the differential diagnosis of disease in our patients. And I'm talking about pets here. We also need to deal with this in terms of breeding animals for genetic counseling. But I'm talking about the health of our pet populations and the dogs and cats that we see every day. So let's talk a little bit about genetic testing. So there are tests of the phenotype, which we call genetic screening, and these primarily identify clinically affected individuals. So a hip radiograph, different blood tests, different heart listening and ausculting hearts. You're doing an echocardiogram, patella luxation, thyroid testing, thyroid profiles. These are all tests of the phenotype. Then there's tests of the genotype, which is genetic testing, which are direct tests of the DNA for liability genes or linked markers. And so we're actually testing the DNA. So genetic screening and counseling in pet and breeding animals. We can talk about hip, elbow, and patella evaluations, eye exams, heart evaluations, coagulation disorder testing, drug sensitivities, tumor testing, where we're actually testing the tumors for their genetics in terms of how they might respond to different chemotherapeutics, bladder stone analysis, thyroid testing, feeding recommendations, bacterial sensitivities. We're actually testing the genetics of the bacteria as to what antibiotics they're going to be sensitive to, temperament testing, behavioral counseling. These are all forms of genetic screening and genetic testing. Most genetic testing only has to be performed once in the animal's lifetime. Direct genetic tests that test the DNA can be done at any time in an animal's life. Hip and elbow radiographs, coagulation disorder testing. I mean, they may have age requirements for doing the tests, but they only have to be done once if they're done at the proper time. Heart testing for congenital disease. Other testing needs to be repeated based on the age of onset and the age requirement for diagnosis. So eye examinations need to be done throughout an animal's lifetime, especially a breeding animal, because you have early onset eye diseases, we have late onset eye diseases, we have cataracts, we have PRAs, we have corneal dystrophies, we've got pannus, we've got all sorts of different things that we can have. Thyroid testing, we need to understand that the temporal period for autoimmune thyroiditis is usually between 2 to 6 years of age, with a peak at 4 years of age, and understanding when we need to do our thyroid testing for thyroglobulin autoantibodies. Heart auscultations for valvular disease, which is something, they call it an acquired disease, but actually it's genetically inherited, but it just happens later in life, and that's why it's called acquired. But these are things where the timing of the testing is important. Most DNA tests are breed specific. So now we need to understand some things because of all the tests that are being thrown at us by the commercial companies. Most DNA tests are breed specific, and tested variants do not cause genetic disease in other breed or mixed breed populations. And we're understanding this more and more. So a disease that is known to be simple autosomal recessive in one breed, another breed is homozygous for that autosomal recessive gene, they don't get the disease because they don't have other genes that are fixed in that breed that has the disease in the background that allow the expression of that disease. And that happens more times than it doesn't. So we need to understand that most genetic tests and genetic diseases won't occur in mixed breed dogs or in other purebred breeds unless they have the same genetic backgrounds to allow expression of disease. Some DNA tests are for ancient liability genes that are shared across breeds. So the PRCD form, progressive rod cone degeneration form of PRA, regardless of the breed background, that is expressed. That is an ancient liability gene that causes disease in all dogs, regardless of their genetic background. The MDR1 mutation for drug sensitivity from the herding breeds, and ivermectin sensitivity and many other drugs. If you're homozygous for that, doesn't matter what the rest of your back, even though the herding breeds are the ones that originated that mutation, if that occurs in mixed breed dogs in a homozygous state, they are going to be drug sensitive as well. So there are some genes that will be expressed regardless of the genetic background of the individual, but most of these will not. So we talked about the PRCD form of PRA. We see it in retrievers. We see it in little Chinese cresteds. We see it in mountain dogs. We see it in schnauzers. We see it in water dogs and schipperkes. And so this mutation occurred in a single dog a long, long time ago. And so the question is not, did my breed inherit this gene? It's, did my breed not lose this gene during evolution and production of that breed? And so it's not surprising that we see this form of PRA in labradoodles and golden doodles and cockapoos and in any other mixed breed individual. Similar findings with lens luxation, mostly in the terrier breeds where that gene is. The drug sensitivity gene, MDR1, exercise-induced collapse we find in a lot of sporting breeds, retrievers, but also spaniels, multifocal retinopathy, and hyperuricosuriasia, which again was 100% in Dalmatians until they reintroduced the new gene through a pointer cross. But we also see this in bulldogs and black Russian terriers and in several other breeds. So WSAVA, the World Small Animal Veterinary Association, the Hereditary Disease Committee under the former chairman, Urs Giger, had developed a database here, and the URL is in your handouts as well. And I would need to go ahead here and switch my, hold on. What do I need to do here? Dashboard. Nope. Sharing, there it is. Okay, so I need to go to, come on, there we go. Okay, so now you should see the PenGen website. So this is a listing of all the DNA tests that are available. So it's really helpful for you to be able to utilize this database because you can look up by disease, by breed, or by laboratory what diseases have genetic tests. So if we say we're looking for dogs and we're looking for a beagle, okay, and well, beagles have a lot of genes that have been identified in beagles. So you've got this syndrome here, it gives you the mutation, but even more so, it gives you the URL for the article that where that mutation was found, and it tells you about that disease, and it gives you all the information that you need to know in that regard. So this is a very helpful website. The PenGen website, which is a WASABA website supported by Mars. So important thing for you to know where you can look these things up. I'm going to go back to my PowerPoint and okay. There's a similar database, the International Partnership for Dogs. So that database is the WASABA database is for dogs and cats. This one is just for dogs, but even more so, they have a harmonization of genetic testing where they actually prioritize the genetic test and tell you, is this test actually valid in each breed, or should this test be ignored in individual breeds? And that's an important concept because many of these tests that the commercial companies want to tell you, oh, your dog is a carrier of degenerative myelopathy, there's only a handful of breeds where that really is an important disease, and everyone else that's carrying that gene is never going to develop degenerative myelopathy. So we need to understand about the relevance of some of these genetic tests. We also need to know that there's a single all-encompassing genetic technology capable of accurately and efficiently genotyping all types of disease-causing DNA variants is currently not available. So there isn't one place you can send in DNA and say, tell me about all the different genes that are possible, because there are many different genes that have to be run on many different platforms to be able to be valid. Okay, next poll question. At least one client has brought me genetic test results on their pet. Yes or no? So now we're talking about direct-to-consumer testing, that a client sent in a cheek swab on their dog, whether it's a mixed breed analysis or purebred or whatever, and they have brought you those results. Yes or no? Okay, so most of us have seen some of these tests, and so we need to understand how to evaluate these tests. So most of these are genetic panel screening or SNP panels. And the two biggest are Mars, who has the Wisdom panel, and Embark, which is just for dogs. Mars Wisdom panel, they have it for dogs and cats. Embark is a company that just deals with dog DNA. But they're both doing pretty much the exact same thing. They're doing a SNP panel. A SNP is a single nucleotide polymorphism, so a single nucleotide, an A, a T, a C, or a G. And it's testing for those single nucleotides across all of the chromosomes. And so they're looking for test results for over 200 genetic diseases, and it's supposed to be reported in terms of known relevance to the specific breed evaluated. Unfortunately, they like to say that many breeds are, because they carry these genes, that they are specific to that breed, even though the disease has never been diagnosed in those breeds. It also tests for more than 35 traits of coat color and types and morphology, genetic diversity testing, which we'll talk about, and it's a cheek swab test. So this is directed to consumer marketing. When people bring you this information, or if they tell you that their dog's been tested, you want to ask them to bring the entire printout and scan it into the dog or cat's file, because it's important that we're able to look at that and evaluate it and discuss with the owner what it actually means, because most of that is going to be misinterpreted. So we need to know what test results are relevant to the tested individual. The majority of these 200 plus genetic diseases are not going to be relevant to any of your patients because they are for rare breed specific diseases that are not going to be the breed that your patient is going to be. The issues with genetic panel screening, first off, is that it only utilizes SNPs or single nucleotide changes, which may not directly test for a mutation. Now, some genetic diseases are caused by a single nucleotide switch. And so in that regard, a SNP test is an actual direct DNA test and an actual direct mutation test. But most mutations are very long translocations or additions or deletions, and looking just for a single letter within this very long mutation will cause false positives and false negatives. So if breeding decisions or treatment decisions in our practice are being made based on a SNP test, we should have a mutation sequence test done that actually tests for the whole mutation that tells us, yes, this mutation is present and causing disease in this patient, or this is a carrier of that mutation. We don't want to make breeding or treatment decisions based on a SNP if the mutation is a much longer variance than just a single nucleotide. All commercial genetic tests are not equal, and some have not been validated in any breed. Now, the tests that are being done by Embark and Mars are pretty much all validated, at least in one breed, although they will tell you that they're valid for all breeds, but they're not. But there are some smaller genetic testing companies that are running genetic tests for hip dysplasia and genetic tests for other diseases where that test has never been validated. It's never been published, it's never been peer reviewed, and they really shouldn't be running these tests because most of them are not valid. They're just trying to make a buck to pick an important topic and say, hey, I've got a genetic test for it. So unfortunately, it's an unregulated area. Unless the gene variants have been validated to cause clinical disease in other breeds or in mixed breeds, the test result may not have any significance in your patient. So your patient might be homozygous for a variance, but it may never cause disease because it doesn't have the other genetic background to allow the expression of that genetic disease. Okay, degenerative myelopathy is a really hot topic now because of issues with that genetic test. So before we talk about it, now this is one where you can answer more than one time. I have clinically diagnosed degenerative myelopathy in a German Shepherd dog, Boxer, Pembroke or Cardigan Welsh Corgi, Ridgeback, Chesapeake Bay Retriever, Bernese Mountain Dog, Borzoi, or other pure or mixed breed dog. If you can remember, you've diagnosed, a German Shepherd dog, a Boxer, 2 Boxers, or whatever, then tap each one of those, multiple times, or answer with that letter multiple times. And let's go ahead and answer and see who we feel that we've diagnosed degenerative myelopathy in terms of dogs, purebred dogs or mixed breed dogs. Okay, so 56% German Shepherd dogs, 33% Boxers, and 17% other pure or mixed breed dogs. The bottom line is this is a genetic disease of German Shepherd dogs and Boxers. So this is where it's a breed-related disease, where we see it the most. In Corgis, Ridgebacks, Chessies, and Bernese and Borzois, there are limited families that have clinical degenerative myelopathy. All other dogs that actually have degenerative myelopathy and they need to be diagnosed post-mortem, if we're going to say that that dog absolutely had that disease, are spontaneous mutations that allowed that disease to occur. And that's what more than half of the human cases of ALS, the human component to degenerative myelopathy, are sporadic cases and not familial disease. So familial disease, for the most part, we're going to see it in Shepherds and Boxers and not in many of these others. So why has this degenerative myelopathy become a hot topic? Well, this is a study by Gina Scoper, which was purchased by Mars, so that runs all of their wisdom panel testing now, of over 100,000 mixed breed and purebred dogs, testing for 152 genetic mutations. And the most common mutation is the SOD1 mutation for degenerative myelopathy that occurs in 7.7% of all mixed breed dogs and 5.4% of all purebred dogs. So this is the most frequent mutation that's found across all dogs. But the disease only occurs in a handful of breeds. CORD1 rod cone dystrophy, CORD1 PRA, really only occurs in English Springer Spaniels and miniature long-haired dachshunds, but it is the second most frequent mutation that's seen, but that mutation does not cause disease in any of those other breeds or varieties. The PRCD form of PRA we know causes disease across all breeds. The MDR1 gene we know causes disease across all breeds, but these do not. So it's a rare fatal degenerative spinal cord disorder. All dogs confirmed with degenerative myelopathy are homozygous for a mutation in the SOD1 gene. But this gene is at a high frequency in almost all breeds. Some breeds have over 90% of the population are homozygous for this mutation, but no one in the breed has ever been diagnosed with degenerative myelopathy. And in the breeds like the boxers and the German Shepherds that have degenerative myelopathy, the frequency of the mutation is exponentially higher in the breed than dogs that are actually clinically affected. So in boxers, 45% of the breed is homozygous for the SOD1 mutation, but less than 1%, or in boxers, it's a little over 1% of the breed is actually affected with degenerative myelopathy. So a big difference between 45% homozygous and 1-point-something% that actually get the disease. So this autosomal recessive liability gene has very low penetrance in terms of the genotype penetrating into the phenotype. The homozygous state is poorly predictive of clinical disease, and there are other unidentified mutations that must also be present to cause clinical DM, which are high in boxers and German Shepherd dogs, but almost non-existent in many other breeds. The other issue is it's not a treatable disorder. No intervention alters its progression. So if you test a client's dog or a client tests their dog with Embark or a wisdom panel, they're going to get back a result that says homozygous for degenerative myelopathy. And you're placing an emotional burden on their lifelong relationship with their pet for a disorder that will likely never occur. And that is really a poor thing for us as veterinarians to do to our clients, to tell them that their puppy or their dog, that their young dog is eventually going to become paralyzed and die from degenerative myelopathy. And a decision to euthanize a dog due to a DM at-risk test when differentials include common treatable diseases such as disc disease and musculoskeletal disease are unacceptable and border on malpractice. And there's published studies. There's a published study on a pug that where the veterinarian, where the dog had, lower spinal cord signs, and the veterinarian sent out for the DM test, and it came back homozygous. And DM has only been identified in 2 pugs worldwide. And the veterinarian counseled the owners to put the dog to sleep, and it likely had spinal cord disease, which could have been treated. And so it's just a wrong thing to do. So testing for the mutation should never be used in selection of breeding stock unless they're close relatives with pathologically confirmed degenerative myelopathy, and therefore a high probability of carrying the other unidentified but necessary mutations. So that's the lesson about degenerative myelopathy. And for many of these genetic tests that are coming on board now, we really need to understand the expression of these diseases, the genetic backgrounds that are necessary to express these diseases, and the validation of these tests. Let's talk a little bit about mixed breed ancestry testing, because a lot of people send in their DNA and they get back to find out, what is my mixed breed dog's background? The results of mixed breed testing are usually accurate for designer bred crosses between 2 breeds and often for crosses down to the grandparent level. especially if they're done by the bigger companies, by Embark or by Mars. However, most mixed breed or random bred individuals do not descend from purebred ancestors. And when descended from generations of mixed breed ancestors, the results identify genetic markers that are shared by common ancestors that preceded the formation of breeds and not purebred ancestry. Because a lot of times we'll get results of American foxhounds, which is the rarest breed in America, okay? And we see a lot of it, of these mixed breed tests saying, oh, descended from American foxhound. Or South Korean Jindo. I mean, I never heard of a South Korean Jindo until I was looking at mixed breed ancestry testing, and we see that breed a lot that's listed in there. And the bottom line is that they didn't descend from those breeds, but they have common ancestors to those breeds. So if you have a dog of hound background, it's gonna test for different types of hounds, coon hounds or foxhounds, because those are shared by the predecessors to those hounds. And so that's something we need to understand about the mixed breed testing, is that it's a feel-good thing, but it's usually there's usually inaccurate when it's coming down, especially to the smaller percentages. So I'm running a little longer than I should, so I want to skip over a couple of things here. And genetic diversity testing is a big topic, especially since Embark a week ago, yesterday and today had a symposium where they're pushing their genetic diversity testing and how homozygosity is bad and everybody needs to select for lower homozygosity, when homozygosity is the basis of pure breeds. And we need to understand that homozygosity, these testing companies themselves, mixed breed dogs have 55% homozygosity and purebred dogs have 65% homozygosity on average. So it's not a huge difference between them, but they're counseling us to only outbreed and not allow line breeding to be done. That's a bad thing, and that's created homozygosity, and breeding is bad because the Bible says so, and all these things. But that's the basis of how you create pure breeds. And the bottom line is these commercial companies have to sell their product. Right now, there aren't enough testable genes for them to say it's important for you to know the results of all these gene tests. But they can tell you the homozygosity of every single dog. And they'll tell you that if this dog has a lot of homozygosity, it's going to be a sicker dog than a dog that has more heterozygosity. And that just is not true. But that is something that they believe. And the reason they believe it is because of endangered species geneticists have developed genetic diversity assessments in order to deal with endangered species. So to understand about this, we need to understand about natural species and natural selection. Any genetic change that improves the chance for survival and ability to reproduce will increase in frequency. Okay, that's the biological imperative of species: survive and reproduce. That's all you have to do to maintain yourself as a species. Lines that are disadvantaged will diminish in influence and die out. Any selection, whether natural or artificial, will cause a loss of genetic diversity. And that's the big catchphrase. Well, we don't want to lose genetic diversity. But we do. We want to lose the genetic diversity that causes disease or that causes impaired health or doesn't allow a breed to reproduce properly. This loss is not detrimental if it's directly related to increasing its superiority. So genetic disease in species occurs through genetic drift because there's no selection going on. Genes go up or down based on genetic drift and the random accumulation of disease liability genes. And healthy carriers of recessive and additive disease liability genes propagate these genes in the population. So if you then have an endangered species where there's a limited number of individuals left on this earth, then what you want to do is you want to outbreed. You want to breed the least related individuals to avoid homozygosity of deleterious genes. And you want to maintain the breadth of genetic diversity or genetic background of the population. That's the basis of species survival plans. But breeds don't have the same population dynamics as natural populations. So when we analyze entire breed population databases, regardless of the size of the population, we see what we showed before: high homozygosity, low effective population size, limited number of ancestors and founders, and high relationships to influential ancestors. So this is normal for breeds, although it would not be normal for natural species. But this genetic diversity is now turned into diversity breeding, where people are saying the only way we should breed is to outbreed and breed the least related individuals together. And so Wisdom Panel has the diversity panel on it. Embark has it. The UC Davis Veterinary Genetics Laboratory also has diversity panels. And there are breeders that all they wanted to talk about is diversity breeding, and that's supposed to increase the health of their breeds. But breed gene pool diversity requires distinct lines to create selective pressure. You need differences between individuals in order to improve something or to move away from something. And outbreeding plans are self-limiting, because if you breed the two most unrelated individuals together, they're now related in the next generation. So that generation has to find an individual that was unrelated to those two lines and finds a line and breeds to them, and now they're all related. And very quickly, you run out of unrelated individuals. You randomize the genes in the population. Outbreeding will not change the frequency of deleterious genes unless you're directly selecting against those genes. So for dispersed breed-related disease, outbreeding will not reduce the frequency of affected individuals. Okay, it's only what will occur is that affected individuals will be produced in a random fashion. And if you want to know what that looks like, look at our cat population, because 95% of our cats in our practice are random bred domestic cats. But we see genetic disease in those cats all of the time. So outbreeding does not diminish the frequency of genetic disease. When breeds show fixation of deleterious traits or significantly diminished fertility or reproducibility, they may require a species survival type of plan to open the stud book to importation or to crossbreeding. But most breeds do not find themselves in this position and only require proper selection to improve their gene pools and their genetic health. So managing breeds requires breed conservation efforts and not species survival plans. So if you're interested in breed conservation, Dr. Phil Spangenberg at Virginia Polytech, he's written a great book. He's done a lot of work with the Livestock Conservancy about maintaining heritage breeds of livestock, and his latest edition of his book includes dog breeds as well, and it talks about managing breeds and breed conservation efforts. Breed health should not be judged on statistics of inbreeding or homozygosity, but on breed health surveys that accurately document the frequency of genetic disease. Now, you've got these commercial companies telling you which breeds are unhealthy due to their homozygosity, and they have no idea what diseases occur in those breeds or whether they're healthy breeds or not healthy breeds. So it really has nothing to do with it, but it's something that they can jump on and say, we can measure homozygosity, it's bad, you need to use our test to breed for heterozygosity. So let's talk about genetic screening in pet animals. And we all know from our clients that they do weird things to their pet dogs and cats. So screening tests in pet animals. We need to test early for inherited diseases that can be prevented or mitigated. Bleeding disorders, von Willebrand's disease, platelet disorders that are breed specific, disorders of drug metabolism, the MDR1 gene, arrhythmogenic right ventricular cardiomyopathy in boxers, because managing the arrhythmia prevents the heart failure that goes on later, or palpation for severe hip dysplasia. If disorders cannot be prevented or mitigated, it may not be in the best interests of the client to test their pet prior to onset. Some of these tests are not fully predictive of disease. There's incomplete penetrance. So we have genes for dilated cardiomyopathy in boxers, for hypertrophic cardiomyopathy in Maine Coons and Ragdolls, for polycystic kidney disease in Persians and Persian-related breeds, degenerative myelopathy in boxers and German Shepherd dogs. And if we test our clients' patients early in life and tell them, well, they've got the gene for that, in many instances, more than half of those individuals are never going to develop those diseases. So why would I tell a client that their dog or cat is going to develop cardiomyopathy if it's never going to happen? So if we can't prevent or mitigate things, or if we can't fully predict it, I wouldn't be running those tests in my clients' pets. But some of these can be used as screening tests to rule out disorders in clinical cases. Sometimes in a shepherd or a boxer, they're scuffing their toes, they're showing hind limb weakness and neurological signs. And sometimes it's a little hard to differentiate degenerative myelopathy from severe arthritic changes, from a cauda equina or spinal cord disease and so forth. I mean, certainly pain is one determining factor for spinal cord disease versus degenerative myelopathy, which is painless. But sometimes, you can have comorbidities. You can have some arthritis that's going on an X-ray, even though it may be degenerative myelopathy or not. And so if we run a DM test and they're not homozygous for the SOD1 mutation, then we know that they don't have degenerative myelopathy, because that's something we can say for certain, is if you're not homozygous for the SOD1 mutation, they're never going to develop degenerative myelopathy. But homozygosity does not itself predict or diagnose disease. Genetic counseling. Owners of large breed puppies should be counseled to feed large breed growth or puppy food for a more uniform growth rate and better joint development. So most of us understand this now, that large breed growth formulas. And puppy food was developed early on because the food companies recognized if you increase the caloric load of foods that dogs grow faster. And so they figured, well, we need to create puppy foods that allow that fast growth rate. Now we understand that by slowing down the growth rate, their adult size has been genetically determined, but how quickly they get there is based on the caloric load as well as other nutritional factors that are in there. And so that's the basis of the large breed growth and puppy foods. Behavioral counseling and early training recommendations should be offered with breeds or individuals demonstrating aberrant or pathological behaviors. And we as veterinarians know that sometimes on our table or on our bench is the only time that those animals show those pathological behaviors, because they're not getting their way. Because when they're at home, they're always getting their way. But you want to poke and prod them and stick them with needles, and they start aggressing towards you. We recognize that these are dogs that need to be trained and understand that aggression is not an appropriate response for a dog. And so if it's severe enough, we need to deal with that and talk to our clients about that, and talk to our clients about appropriate breeds for households. That some terrier breeds and some other breeds might not be the best for homes with young children, and those types of things. Dietary recommendations should be offered for cats having presented for crystalluria with feline neurologic syndrome, dogs and cats with non-struvite bladder stones, since the majority of our control on those is going to be dietary as well as sometimes medications. Obese cats, pre-diabetic counseling, since obesity is a huge predisposing factor for diabetes as well. The availability of phenotypic or genotypic tests. We need to understand what tests are available. We can look on that Wasava PenGen website, where the test can be performed. Again, that website tells us that. The cost of testing as well, the websites tell us that. Which animals should be tested? We need to understand which tests are valid in which animals, and what does the test actually tell you? What does it predict, so that we can pass that on to our patients. On a client acquiring a new pet, when they inform you that they're looking to purchase a dog or a cat, we need to talk to them about the behavioral and genetic expectations of the breed. Now, I understand, because I'm a clinician, that a practitioner, that most of the time, the first time that you see that they're even thinking of getting a new dog or cat is when they present you with that puppy or kitten in the first visit. But sometimes they'll actually ask you before they make that purchase what they should do and what they should look for. We should provide them with a list of the genetic health test requirements specific for those breeds, and I'll show you where to look that up. And ensure that they understand that they should only buy a pet from parents with verified genetic screening results. Health-tested parents produce healthier offspring, and that's the bottom line. If genetic screening is not being done on breeding animals, then we can't expect their offspring to be healthy. When acquiring a puppy or kitten, the emotional aspect of adding a new family member often overwhelms this important decision. And this should not be an impulse purchase. So we really need to talk to our clients about using our brains as well as our hearts when looking to purchase or acquire a puppy or a kitten. Owners must be informed consumers when purchasing puppies and kittens. They should spend as much time researching as when purchasing a home appliance. There are some people that'll spend weeks researching a refrigerator, but they'll go and buy a dog or a cat on the internet and without asking a single question about the breeding or the parents. Without evidence of pre-breeding genetic screening, health guarantees that provide for a replacement of a family member once the emotional bonds have been made are worthless. And those are what the health guarantees are that breeders have. It's a uniform, standard writing across all health guarantees. It says that if the animal has a genetic disease, they will replace it with one of equal value. But cats and dogs are not toasters. Once that emotional bond has been made, no one wants to give up their pet. What they want is a healthy pet. And so that's what's important here. If you have a new kitten or puppy appointment, my staff has instructed the owners to bring all paperwork, everything that they've been given, whether it's from a pet store, whether it's from a breeder, whether it's from an online individual. Everything that they've been provided, they should bring in, and we scan that into the record. The medical records, most importantly, the registration paperwork and pedigree, the breeder's contract, if there is any kind of guarantee or any kind of limitations. It's interesting what some of those breeder's contracts say. If official documentation of parental health testing is not present, look up the health stats in online databases like the OFA, and I'll show you how to do that. So if you get a registration certificate or if you get something from the pet store, it usually will have a registration number on the sire and the dam. And you can put that number into the OFA website and look it up and see if any health testing has been done, since that is the largest repository of health testing information. The OFA actually puts hip, elbow, and eye results right on the registration certificates. So this dog had OFA good hips at 25 months of age, normal elbows at 25 months of age, and normal eye exam at 26 months of age. If verification of genetic testing is not available, then the kitten or puppy was not produced by a health-conscious breeder. There's no expectation of genetic health, and you and the owner can only hope for good health. And that's not really the best way of dealing with genetic diseases. Well, I hope everything is going to be okay. When a client tells you that they're planning on breeding a dog or cat, look up and discuss the pre-breeding health tests that should be performed. Review the medical history for evidence of genetic disease, because there are many diseases we can't test for. Allergies, for one. So you need to look and see, has this animal presented to the veterinarian for episodes of allergic disease. Emphasize the ethical responsibility of pre-breeding genetic testing, and for those tests that cannot be done at your clinic, let them know where they can be done. So cavalierhealth.org has an excellent website that's been maintained by the Cavalier King Charles Spaniel. I'm not going to go to it because we're short on time, but it lists all health testing clinics in the United States and Canada. And if you look up right now for Texas, there's actually, it's usually hundreds of clinics because they're all done at dog shows, mostly these clinics, where you have an ophthalmologist, a cardiologist, a radiologist doing hip radiographs, and they can get all of their testing done in one place. You've got Bayer testing for hearing and other tests as well. Improving genetic health through health-conscious breeding. Okay, approximately what % of your breeder clients perform pre-breeding health screening? 75 to 100%, 50 to 75%, 25 to 50%, 1 to 25%, or 0%. Just give me a guess there, okay? Maybe you only have 2 breeders in your practice, so base it on those 2 breeders. What % do pre-breeding health screening? Come on, more than 3 of you have to answer this question. Okay, 4 of you. Okay, so most of us are saying 0% or 1 to 25%. Some of us have 25 to 50%, which is great. Most of us, the answer is going to be 0 to 25%, because it just isn't being done. It's not the breeder's mentality, unfortunately, as to what's going on. Early on, breeders judiciously removed animals from breeding that were unhealthy, could not excel, or did not conform to a healthy standard. Somewhere along the way, the responsibility to select for health and produce healthy offspring disappeared from breeding. People just breed and expect healthy offspring. If artificial selection does not select for health or selects for deleterious phenotypes, then there can be no expectation of genetic health. The genetic health of the breed will decline. So genetic screening is a requirement, it's not a choice. So if we have breeder clients, we need to tell them that genetic screening is a requirement and talk about the ethical responsibility. The only way to select against specific genetic disorders is to specifically select against causative reliability genes through direct DNA testing or phenotypic genetic screening. The most common genetic diseases are complexly inherited, involving several genes and environmental factors. Most have no DNA test. Many have no screening diagnostic tests and require medical history for diagnosis. Allergies, bladder stones, bloat, epilepsy. I mean, there's plenty of genetic diseases where we have no yes or no DNA test or even screening test. Breeding control requires the knowledge of the familial history of affected individuals. Are other family members affected with this disease? Pre-breeding health screening and the planning of any proposed canine or feline mating, the selection of healthy parents is paramount to the health of the offspring. A pre-breeding health examination includes the major organ systems from musculoskeletal, cardiac, ophtho, GI, pulmonary, dermatologic, and behavioral abnormalities. It should also include breed-specific genetic screening specific to the individual breed. Pre-breeding health screening evaluates the health worthiness of the individual for breeding. And if the public demands healthier pets, then this is where it must occur. These recommendations apply to both purebred and mixed breed breeding. So as I said, designer breeds came about 15 or going on maybe even 20 years ago now, because of the idea that, well, if you're crossing breeds, they're mixed breeds and you're not going to see genetic disease. And we know we see plenty of genetic disease in designer breeds as well. And now you've got the bred for rescue industry that has really blossomed. So it doesn't matter if it's a purposeful breeding, then pre-breeding screening is what needs to be done. The fact that it's a mixed breed mating does not mean that you're not going to see genetic disease. So breed-specific health screening, we have the OFA, and then we have for cats, International Cat Care. And I'm going to show you International Cat Care really quick. So I need to switch out here. Okay, so the International Cat Care website, if you go down to cat breeds, and so let's say Abyssinian, okay, it will tell you here that Abyssinians can have pyruvate kinase deficiency. They have PRA, they have patelloluxation. They also can have hip dysplasia. They can have amyloidosis. And if you click these, it'll tell you about those diseases in those specific breeds. So that is something that we need to look at there that we have available to us. Okay, the OFA. So I want to just show you a couple of things about the OFA website, because if you haven't been there recently, it's really changed. So here we go. On the OFA website, the first thing is, if you have the registration information on the parents, you can type in either the name of the parent or the registration number, whether it's AKC or it's any kind of registration number. And if you type it in and it says no entries match your search entries, that means that no genetic test results have been recorded at the OFA website. Maybe they have done some health testing and they didn't record it with the OFA, although all eye examinations by ophthalmologists now automatically go into OFA. So that there's a lot of, and cardiac is starting to become the same as well. So what genetic health screens should my breed have? Tests by breed. So this is the CHIC program here. And so here are all the different breeds. It's not every breed, but these are all the breeds where the parent breed club has determined what genetic tests should be done for that breed. So for instance, the German Shepherd dog should have hip x-rays, elbow x-rays, a temperament test, and these are all been determined by the parent breed clubs. The German Shepherd Dog Club of America realizes that Shepherd temperaments have gone downhill, and they want temperament tests done on breeding animals. And then optional, a cardiac evaluation. So we do have a breed-related arrhythmia that causes sudden death in shepherds, but it's a low frequency one. So they're putting it there as optional, telling you that there is an issue with heart disease, but it's not in the mainstream, all of the shepherds. Thyroid disease, an eye examination, and degenerative myelopathy, and these are optional tests. But the required tests, hip, elbow, and temperament. Now, these are the required testing requirements before anyone breeds a German Shepherd dog. And you can click printer friendly and print this out and hand this to someone that wants to breed their Shepherd. Or you can print this out to someone that just brought you a German Shepherd puppy that has no observable health testing on the parents, and say, can you please ask your breeder for the official documentation of this health testing? And I counsel my clients to do that. And I say it's not a judgmental thing, but if we don't call the breeders on it, if we don't at least say, hey, my veterinarian said that all German Shepherds that are bred should have these tests done. Did you do hip x-rays on it? And then, and tell your client to listen to the excuses from the breeders and just thank them very much. But the bottom line is the breeders are being put on notice that the public is looking for the health testing. And if the pressure's coming from the public, that will increase the amount of health testing that is going on, and that will increase the health of our breeds. There are a couple of other things that are interesting here just for you to peruse at another time. Breed health surveys are really helpful because it tells you what's going on in those breeds. So you can view the results. This is a closed survey, but you can view the results of the health surveys, and it'll tell you, aside from a lot of other questions, it'll ask you about different genetic diseases. So cancers, GI, cardiovascular, respiratory. And if someone's filling out a survey and they say, yes, the dog has that, then it will then ask specific questions. What types of tumors are going on? What types of issues are going on with them? GI problems, inflammatory bowel disease, heart murmurs, or specific diagnoses. So this is where you understand what diseases are occurring in the different breeds. And lastly, if you go to breed statistics, you can look up and see on any breed. So here we've got, let's Bernese Mountain Dog, show the statistics. Here are all of the test results on Bernese Mountain Dogs across all the different types of databases that are present, because they have von Willebrand's disease, 1.6% affected. They have shoulder OCD. They don't really have much patelloluxation, a little bit there. Histiocytic sarcoma. They've got exercise. They don't have that. So some people are testing for it, even though it's not a big disease. And then you see your elbow dysplasia statistics, your degenerative myelopathy statistics, because that's one breed that has that. So this is not how many are affected, it's how many are testing homozygous for the SOD1 mutation. Percent affected is going to be a very small fraction of that. But here's your test results on the OFA website. So it's a very useful website to go to. Let's get back here. Okay, so pre-breeding health screenings should become as universal as equine pre-purchase exams. This is one of my new mantras that I tell breeders. No one buys a horse without a pre-purchase exam, because you wouldn't know whether that horse has laminitis or navicular disease and can't be used for the purpose you're purchasing it. No pre-breeding health screening should become as universal as that breeders automatically do their health screening. It's important for us to counsel our clients to authorize for the release to the OFA for abnormal results. And a lot of breeders don't want to do that, but most breeders now are starting to understand that no one can be blamed for these results. There are no perfect dogs, okay? But if you don't, for complex inherited disease, if you don't know about the affected individuals in the background, then you don't know where the risk is coming from. And so it does take a village, and it takes breeds to be able to say, okay, we should release that information. As long as we keep problems secret, we will not be able to deal with them. In the days of stigmatizing conscientious health testing breeders who have produced dogs or cats with hereditary disease are over. I know that's a pie in the sky statement, but the bottom line is the stigma now lies with those that hide the occurrence of genetic disease. So I'm going to skip through. So breeders should perform pre-breeding health screening, look up health screening results on prospective mates, and plan matings that minimize genetic disease. When searching databases, if test results are not available, then it must be assumed that they are affected or carriers, otherwise those results would be there. So who is a reputable breeder? It's one that does genetic screening. If not, they should find a different hobby or profession. This is actually an applause slide whenever I speak to different breeder groups, because they do understand that if you're not going to do pre-breeding health screening, find something you can do that you can be good at, because you're not being good at being a breeder in that regard. Okay. Genetic counseling for breeders. The old breeding recommendations were just don't breed those two together again, breed to an unrelated male, you probably won't see it again, or spay and neuter your animals and restart with someone else's animals. So those things will probably give you a good result in one generation, because if you breed to somebody else, the likelihood that they're both carriers of something that are going to produce an infected is going to be lower, but you're still passing on carriers and passing on deleterious genes. So breeders want to know what they can do to continue their lines. And I'm not going to go through all the different modes of inheritance here because we're running short on time and I want to take some questions. But one of the articles that that's on the website, or on, that your VMA that I gave to them, is on breeding recommendations, and so it goes into these in depth. So managing genetic disease. I'm going to talk a little bit with carriers of recessive disease that has a genetic test. Without a genetic test, the effect of selection on the gene pool is minimal. With genetic tests, if everyone decides not to breed carriers, it can have a significant limiting effect on the gene pool, because a lot of carrier, results would be 15% or so. And can you lose 15% of your gene pool and not have a detrimental effect on genetic diversity? So the proper response, if you have a testable carrier test result on a disease that is relevant in your breed that causes genetic disease, the proper response is to breed quality carriers to a normal individual and replace the parents with a quality normal testing offspring. So you want to test the offspring and replace the carrier parent with a quality normal testing offspring. You don't want to put a lot of carriers from the offspring from that mating into the breeding pool, because a carrier to normal mating produces 50% carriers, and most genetic diseases don't have that high carrier rate. So you're going to increase the frequency of carriers by putting those into the breeding pool. So you want to replace a carrier with a normal and not put more carriers into the gene pool. Okay. So polygenic disorders are the last thing I want to talk about. You want to identify phenotypic traits tied to the underlying genes. Breadth of pedigree provides information on the possible range of genes carried. And treat disorder is threshold traits where several genes must add up to cross a threshold that causes clinical disease. And you want to breed normal dogs from mostly normal litters, normal dogs or cats from mostly normal litters. So for hip dysplasia, if we want to break down the phenotype, you need to look at that hip radiograph. Are there deep acetabula? Is there a nice round femoral head? Is that round femoral head deep in the acetabula? If you've got shallow acetabula, you want to, in a dog that has a fair rating, or even a mildly dysplastic rating, that in other wise quality dog where there's a lot of hip dysplasia in the breed, maybe you breed that, but you breed to a dog that has deep acetabula, so that you're actually selecting for genes that actually control those things. If you have laxity, then maybe you need to get pen hips done and objectify that laxity, so you can breed to dogs with tighter hips and select against laxity, which is also genetically inherited. So you need to break the phenotype down to traits that may be more directly related to the genes that are involved. Depth of pedigree, people will say, well, I've got 3 generations of normal hips or normal whatever, but breadth of pedigree tells us more about the genetic potential of the individual dog. So if this dog has normal hips and most of its litter mates have normal hips, you can feel pretty confident that this dog has genes for normal hips. But if you have a dog with normal hips where a lot of the litter had dysplasia, then you really need to question the amount of dysplasia liability genes this individual carries and what they're going to pass on. So the breadth of pedigree tells you more about the genotype of this dog than this dog's own phenotype. And as an example, another thing I didn't show you on the website, but you can go to individual dogs on the OFA website and it shows all their test results and all the test results of their relatives. And you can go to something called vertical pedigrees, which will break it down by diseases. So you have a hip vertical pedigree, you have an eye vertical pedigree, you've got a heart vertical pedigree. So here's a dog, this is a golden retriever who has an excellent hip result, had 2 siblings that had good hip results. If we look at this dog's pedigree and the breadth of pedigree here from the vertical pedigree, his sire had fair hips, had 3 siblings, 1 good, 2 fair. His dam had good hips, 13 siblings, 8 good, 5 fair. The paternal grandsire fair hips, 3 good, 1 fair hips, good hips, 2 good, 4 fair hips, 12 good, 5 fair. So looking at the pedigree of this individual, we'd expect his genes to be somewhere between good and fair for what he's passing on, even though his phenotype is excellent. Well, this dog was bred extensively. He had 126 offspring in the OFA database, and certainly 50% of the genes come from the bitches that he was bred to, but you have to expect on average they probably had good hips. And so what did he produce? Well, majority he produced good hips, but he produced 10 excellents and 37 fairs. So his offspring, and he had some dysplasia there too, but his offspring were primarily somewhere between fair and good and not good and excellent. So what he produced from his genotype is more representative of his breadth of pedigree than of his phenotype just by itself. And that's the way we need to look at things when we look at complexly inherited disease or polygenic disease, which is the majority of genetic diseases that we deal with in practice. So they need to be treated as threshold traits. A number of genes must combine across a threshold to produce an affected animal. If we say theoretically it takes 5 genes to produce an affected individual, and the average between the 2 parents is at 5, we can't be surprised that we're seeing affecteds. But if 2 clinically normal individuals produce an affected individual, that individual had to receive liability genes from both parents. And that's something we need to understand. It isn't just the damn stud dog that breeder bred their bitch to. Both parents had to contribute liability genes to produce that disorder. And this is from an article that we wrote based on almost 500,000 dogs that had OFA evaluations, where both parents also had OFA evaluations. And here's the evaluations of the dam from excellent to severe, and here's the sire from excellent to severe. And we gave them numbers, 1 for excellent and 7 for severe. And we did what's called combined parent scores. So here an excellent to an excellent gives us a combined parent score of 2, and we see 3.6% dysplasia. A good to an excellent, 6.1. Or for a 3, a good here to an excellent is 5.8. And I've colored in the squares where the combined parent score is the same, regardless of what the ratings were. And what we saw was statistically highly correlated by the combined parent score. I want to point out one thing to you here. Good to good, over 200,000 dogs. Severely dysplastic, bred to moderately dysplastic, 49 dogs and 52 dogs down here. I just needed to point that out to you because here's the combined parent score from all that information here. A completely linear accumulation of hip dysplasia based on that combined parent score, and the only outlier is that 13, which was those less than 100 moderate to severely dysplastic dogs. Otherwise, when you add up all the dogs, hip dysplasia based on the OFA rating is an absolutely additive genetic disease. And so there is a difference between fair hips and good hips, and especially if those dogs were under anesthesia or deep sedation to the point of muscle relaxation, so we're not masking dysplasia. But that's how we need to look at hip dysplasia and how we need to control it, as well as other complexly inherited disease. And if you take that data and add the number of normal, phenotypically normal grandparents to those parents, even the twos, which are excellence to excellence, if you have no normal grandparents in the OFA database versus 1, 2, 3, or 4 normal grandparents, it again significantly diminishes the frequency and the percentage of dysplasia. So breadth of pedigree as well as depth of pedigree normalcy. Estimated breeding values and genomic breeding values, I'll let you read about it in the handout. These are things coming in the future. We don't have those now, but they certainly are the future of genetic selection in the future. We have these things for large animal production animals, and the issues with dogs and cats is that we don't measure every single litter mate in every single individual in order to plug in those values, and that's where that information is going to come in handy in the future. Identifying carriers or risk of carrying disease liability genes. Breeders should work away from the defective genes and prevent the reintroduction of genes in future breedings. All populations thrive by avoiding the popular sire syndrome, utilizing quality individuals from the breadth of the population to expand the gene pool, monitoring health issues through health surveys, genetic testing and screening, participating in open health registries to manage genetic diseases, and constant selection for quality and for health. With increasing availability of genetic tests, there's an increased risk of misusing and misinterpreting them. Commercial genetic testing companies want to run unnecessary or inappropriate tests on our patients. I'm sorry, but it's true. They want to sell you more stuff. Okay? It's our responsibility to discuss the proper use and the interpretation of these genetic tests. Breeders are looking for objective information, whether it's good or whether it's bad. And sometimes we want to shy away from telling them bad things because we don't want to lose them as clients. But the bottom line is they're looking for the information. Don't be afraid to deliver bad news to your clients. Couple it with a constructive plan for breeding improvement, for you to help them help themselves with their breeding programs. All dogs and cats deserve to live healthy lives. Okay, so I didn't leave a lot of time for questions, and I don't want to go over too much because I know all of you need to go to bed and then see appointments again tomorrow. But I'm going to see if we have some questions, or if anyone wants to ask questions. How can we do
Hi there,
this?
thanks, Dr. Bell. Can you hear me?
Yep.
Okay. So pretty interesting. I thought for me, we'll wait and see if some people have some questions to chime in here. One question I had was regarding the designer breeds, and whether or not in people, I guess, combining things for maybe, the way they look, are you seeing any situations where diseases actually are heightened or more prevalent in some of these designer breeds?
Well, again, in dental disease with misplaced teeth and crowding and malocclusions, we do see a lot of that. Otherwise, if you're breeding a chondrodystrophic breed to a non-chondrodystrophic breed, we can, in chondrodystrophic breeds, they have much worse hips, they have much worse, joints, but they have been selected to pick for the best joints of those individuals. But if you breed them to a normal breed, you don't have that selection that's gone on. And in a normal breed background, you can then recreate bad joints again. So those are the most common things that I see.
I guess one of the things I'm thinking about are some of, I don't know if you'd call them off-target or non-intentional features. So, in trying to select for some, configuration for the chondrodysplastic breeds, do you end up with more heart disease, or do you end up with more allergies, or do you see some of those offshoots?
Again, so you're talking about linkage, okay? So you're saying, do certain things travel, do certain disorders travel with certain phenotypes? And we do see that. We certainly see with different pigmentation, we see a lot of deafness issues, whether it's with the Merle genes or whether it's with the extreme piebald spotting or white coat color. We see deafness that moves along with that. I can't say that heart disease specifically travels with certain phenotypes, except for the toy breeds. I mean, if you really breed down in size, we don't see mitral valvular disease in our big dogs. We see it in our little dogs. So certainly there is a phenotypic relationship for that, and it's the same thing with the short-statured and toy breeds with patelloluxation. Although we do see patelloluxation in chows and in Labradors as well in large breeds. So it really depends on what phenotypes. We see cruciate ligament rupture much more in certain breeds. And I believe that has to do with the morphological structure. Some breeds have been bred for a much straighter hind limb conformation that predisposes to trauma on the and excess stress on the cruciate ligament. And so I think a lot of surgeons recognize that there's certain morphological variations that they see more cruciate ligament rupture in. But certainly there are certain breeds that have much more cruciate ligament rupture, and it's based on the morphology of those breeds as well.
I see. Thank you. Of course, I'm always thinking about cancer questions, and so what comes to mind for me is some of the doodle dogs. I think not as commonly anymore, but I feel like when they get bad disease, it tends to be bad, or the gray pitties, for example, with mast cell.
Yeah, absolutely. And certainly with hereditary cancers, as those genes accumulate, we see them coming earlier and earlier. So the dogs that are coming up, young, the 4-year-old dogs with lymphoma and so forth, that there's a very strong genetic predisposition for that. And it's not just the genetics that cause the disease, but then using immunohistochemical staining on our tumor samples to inform treatment decisions, because there are certain tumor signatures that'll tell us that a long-lasting remission can occur with a CHOP protocol, whereas other tumor signatures will tell us, since first remission is the best remission, don't go to CHOP, immediately go to the next step, because CHOP's not going to work in this breed. And those are the work of Modiano and Breen who've worked that out. So lots of great stuff with oncology and genetics, and looking for what Matthew Breen calls the Raleigh chromosome for that test for transitional carcinoma, cell carcinoma for bladder disease, based on a simple urine sample now. So lots of great tests that are coming down the line. The bottom line is we've used biomarkers. The new thing is biomarkers. Let's use biomarkers as signatures of genetic expression. But the bottom line is all of veterinary medicine is biomarkers. An ALT, a BUN, these are biomarkers. And even though they're not direct tests for genes, we diagnose disease with them. And so it's just our understanding of how certain things are inherited and our knowledge of that enables us to use them and leverage these test results in a better way for our clients and our patients.
Great. Well, I appreciate your time. I don't see that anyone has any questions unless I'm missing those.
Okay, well, thank you all for your attention, and I'm pleased that I'm able to talk to practitioners like myself in a little bit more relaxed environment, and be able to share some of the things that I believe are important to me as a practitioner in trying to make my patients healthier and create healthier dogs and cats as well.
Absolutely. Well, we appreciate it. And just for those still in attendance, we will be sending out the CE2 certificates as we do monthly. So just if you don't get yours, please let us know. Thanks again, Dr. Bell. We appreciate your time.
Okay, thank you. Take care.
Okay.
Good night, everyone.
Bye-bye.